Hi everyone, and welcome to today's webinar interview with Melanie McGrice. I'm really excited to have her here today and to share her experience and her wealth of knowledge with you all. I know earlier in the year when I asked for requests for the topics to be interviewed, certainly pregnancy and weight management was high on the list, so I'm really excited to have Melanie here today with us. So before we get started, I just thought I'd share a little bit about Melanie's background with you so you can see what her experience and where she's come from. So Melanie is an advanced accredited practicing dietitian with a master's degree in dietetics and is also the director of Melbourne-based nutrition practice, Nutrition Plus. Melanie specialises in weight management and was awarded the Excellence in Dietetics Award in 2012 for her outstanding work in this area. She's also renowned for her work in PCOS, fertility, multiple sclerosis and surgical patients. Melanie is the author of 3 books on nutrition, including Australia's best-selling book on nutrition for pregnancy, The Pregnancy Weight Loss Plan, and she has also co-authored several papers published in peer-reviewed scientific journals. An experienced media spokesperson, Melanie is regularly interviewed for television, news, for current affairs and lifestyle programs, as well as radio and print media. She's been featured in Women's Health, Women's Day and Good Health magazines, and is seen regularly on Sunrise, The Project and Channel 9 News. Melanie is definitely passionate about educating Australians to eat well, appreciate good food and maintain a healthy lifestyle so that they can feel great and get the most out of life. So I'm extremely pleased to welcome to today's interview one of Australia's leading dietitians, Melanie McGrice. So thank you and welcome, Melanie.
Well, thank you so much for having me, Sonia.
So I thought maybe before we get started talking about weight management before, during and after pregnancy, maybe you could share with everyone listening today what it was that once you became an accredited dietitian that got you interested in specialising in weight management, for particularly before, during, and after pregnancy.
Yeah, absolutely. Well, and actually, as you just said, my first passion was actually weight management. And I think I started off my career working in a major Melbourne metropolitan hospital, and I was working on the wards, but part of my role there was to work in some of the outpatient clinics, so with conditions such as diabetes and polycystic ovarian syndrome. And with those medical conditions, one of the biggest things that has an impact on them is weight management. So I was doing that as part of my education from right from the start, and I think for me it just really clicked in that I'm somebody who's a lover of people, and a lot of working in a hospital is working with people who are very sick, and you often don't get the opportunity to develop relationships with them and so forth. Whereas working in weight management, I really got to see the impact of my advice, and well, as everybody who's listening knows, you know, all you guys are working in weight management already, and so you all know how great it is when you are helping somebody get results and what an impact that has in their lives, and so it's just such a fulfilling career. But one of the questions that I was regularly asking my clients was, well, when did you start struggling with your weight? And over and over and over again, you hear the answer that it was after pregnancy, after they'd had their babies. And so I decided to actually do some research into this and have a bit more of a closer look into this. And it was sort of about that time that I started really working more in fertility, and yeah, it just kind of went from there. And not long after, I put the book together, and the rest is history. So yeah, it's such a meaningful time now. There's so many women in Australia who are trying to fall pregnant, but either insulin resistance or being overweight or underweight is one of the biggest impacts that affects their fertility. And then secondly, during pregnancy, the research shows very, very clearly that women who gain too much weight during pregnancy, that has a huge amount of complications throughout pregnancy, and also for both the mum and their baby's future weight. So I think that it's really the most important time to impact the weight of somebody.
Yeah, definitely. And I think you're right. I know from, even when I was working in the industry myself, and, you speak to clients and they say, oh, it's post-baby weight, and you ask how old their child is, and they're like, oh, 6. And they, and they're serious. They just haven't been able to get back their pre-baby weight. So I definitely think that there is a need, and it's great that, that there's someone like yourself who actually specialises in that area, because women, they do struggle and they're not always sure, whilst we think it's simple, to a lot of people it's not.
That's right. Well, a lot of women might put on 20 kilos during their first pregnancy rather than the recommended 11.5 to 16, and then they've still got 5 kilograms to lose when they have their second baby, and they put on another 20, and then by the end of that they've got 10 kilos that they haven't shifted, and then they have their third and put on another 20, and then they've got sort of another 15 kilos to lose, and then so come, as you say, 10, 20 years down the track, they've got this extra 15 kilos that they just can't get rid of, and sometimes more.
Yeah.
So it's a really important time.
So you mentioned, I guess that you deal in the fertility side as well as during pregnancy, and obviously then that has an on-flow effect to post-pregnancy. But what would you say are the top 3 weight-related pregnancy issues you see in your clinic?
Yeah, well, I would say fertility would be the primary one, because there's nothing, I think, more motivating for a woman than not being able to fall pregnant when she really wants to. So, so I do work with a lot of women now who are trying to fall pregnant, and weight management has a big role to play in that, as well as nutrition. And then the second one I would say would probably be just weight management during pregnancy. I see a lot of women who maybe have something like a pelvic problem where they can't walk, they're not allowed to walk for the rest of their pregnancy or something along those lines, and so are actually gaining weight quite rapidly because their physical activity has dropped so rapidly. So I'll often get referrals for those types of clients. And then the third area I would say is probably gestational diabetes, which is quite a common problem now as well.
And I guess looking at, we all know the obesity epidemic has, continues to increase. So, from your time in the industry, would you say that you've seen, I guess, a correlation in the increase in people who are having fertility issues or gestational diabetes? I guess, correlating to the increase in people being overweight or obese?
Oh, absolutely. I think that, that the two are definitely going hand in hand, and like the IVF clinics that are now around Australia and around the world really weren't, they weren't even something that people spoke about 10 years ago, whereas now it's quite common for people to be speaking about going to an IVF clinic. Fertility problems are a really, really big issue in our current environment, and a big part of the problem with that, first of all, it's women wanting to fall pregnant at a later age, but secondly, it is because of the fact that women and their partners are not only coming in with higher body weights, but also having less nutritious diets, and so having more nutrition problems. And they go on to have quite significant impacts. And in particular, the biggest problem with fertility is insulin resistance. So it's estimated that about 60% of people who are overweight have insulin resistance, and many of them are undiagnosed, and that insulin resistance is thought to have a very big impact on the production of other hormones like your progesterone and luteinizing hormone, and so it impacts that hormonal environment of the ovaries and therefore fertility.
Wow, that's really interesting. That's something that, I guess I haven't heard a lot about. So it's, if we're in the industry and we're not really hearing a lot about the impact of insulin resistance on fertility, then, I guess what hope do the general public have if they're not aware of this?
Yeah, and I think this is the big thing, is that there's a lot of research coming out now about the impact of being overweight, both for fertility and during pregnancy, and the huge amount of impacts on fertility, on childhood obesity, and also on the mum's future weight and weight-related comorbidities. But yeah, most of the time it's kind of still stuck in the research at the moment. So there's a lot of work to communicate that to other healthcare practitioners, and then to get it out to the general public. And I think, I mean, in essence, a lot of it is also common sense. But what we are seeing now is that there is actually a lot of research behind everything that we're saying.
And do you cover any of that research in the book that you've written?
Yeah, I do actually. I do cover just sort of a basic overview of some of the research. The book is, being a dietitian, you know, we're always very research-based.
Yeah.
And so, yeah, the book is certainly based on research. Yeah.
Yeah, it was interesting also that you mentioned you know, the link between the insulin resistance and also the childhood obesity, because 2 months ago I interviewed Dr. Chris Beer. She specialises in nutrigenomics, and it was just really interesting also in the science they're doing in genetics, and how, you know, the mother's eating habits and the genes that she has switched on, she's passing on to her children, and so that can affect, you know, them ongoing in their life. So they could be, you know, starting off their life on the back foot if, you know, if the mother during her pregnancy and prior to getting pregnant, you know, isn't eating healthily.
Yeah, that's right, and it's actually really, really exciting, all this research that's coming out, and so what we call this early life nutrition. So it's the 12 months before a woman falls pregnant through to the first 3 years of life. There's that window of time that basically sets all of the genetics for that child's future health, and does impact both weight management markers, but also a whole lot of other long-term health issues as well, such as allergies and diabetes risk and a whole range of things. So it's what a mum eats both before she falls pregnant and during pregnancy is just of such high importance. And like I was saying, that message really hasn't got out to the community yet, and so it's something that is really important for us to be starting to communicate to our patients. I actually see so many mums now just there seems to be this real environment of women worrying about listeria and being quite nervous to consume any foods that are fresh, just to avoid the risk of listeria. So it seems to be a reason for a lot of women having diets that are quite highly processed, but in turn they're actually risking not only the extra kilojoules, but also the huge lack of nutrition and the impact that can go and have on the genetic predisposition of their children. Another really interesting thing is that you're not only, when your baby is in your womb, you're not only setting the DNA for your baby's future health, but also for your grandchildren's future health, because your baby's DNA is, you know, their eggs or sperm is actually being made while they're in utero. So you're actually impacting the weight and health of the next 2 generations while you're pregnant.
Wow, it's so interesting, really, when you start to, you know, think about it from a deeper perspective of just that you're going to have children, but yeah, that you're actually affecting the entire life of 2 generations.
Absolutely, it's really exciting.
So I guess you know it is important. I agree with you that we get or that we communicate this message out to the public. And I guess for those listening, have you got any suggestions, or are there any platforms, or, you know, how can we help to get this message out, I guess, to the broader community?
Look, I think just the best way is through word of mouth. And, you know, like I said, at the moment I hear so many women, they fall pregnant and they say, oh, well, I can't eat that salad for lunch because I might be affected by listeria, so I'm going to have this, this packaged meal instead. So I think just reinforcing to those people and just really through that word of mouth and just telling people that what they eat during pregnancy, that it is the most important time for their nutrition, and that it's not about eating for two, but it's about eating, not about eating the quantity for two, but it is about eating the quality for two. You never need more nutrition than you do during pregnancy, and I just don't think that message is got across yet. So I think it's really just about reinforcing that to all our friends and family, and the message will get over. We'll continue on from there.
Yep, fantastic. I've just had a question from Daniel, who's listening in. He just wants clarification on, are you saying wisteria, and I guess also we've had another question, just if you could go into more of what that is?
Oh, sure, sorry. Listeria toxicity is, listeria is a type of bacteria that causes food poisoning. And there's a lot of brochures, and when women are in chat rooms and so forth, and I guess mainly through word of mouth, there is warnings against eating certain foods during pregnancy due to listeria toxicity. So when you're pregnant, you need to be more vigilant about developing food poisoning than any other time of life, because if you do get food poisoning, in particular the food poisoning of listeria, it can actually cause miscarriage. So it is of increased risk during pregnancy, but at the same time, I think that women are often more concerned about listeria poisoning than they are about eating healthily, and that's where it becomes an issue. So the recommendations are any of the foods that are more likely to contain any type of food poisoning. So making sure that your hot foods are hot enough, so things like if you're having chicken or meat or whatever, making sure that they are actually cooked to over 60 degrees, so that you're killing off any listeria bacteria or any other types of bacteria. Avoiding foods like soft cheeses and soft serve ice creams and cold hams and things like that can often have increased risks of listeria. And then also things like eating at a salad bar or wherever, things like that, where people, there's a higher risk of contamination. So you certainly have to put in, be very vigilant about your health and about avoiding, and about your food safety during pregnancy. But at the same time, I don't think that it means that people can't eat salad or they can't eat healthy foods. They just need to put in a bit more planning, I guess.
So what advice do you give clients that come to you who have, I guess, gone completely on the I guess, far end of the spectrum, who aren't eating fresh foods because they're concerned that they're going to get listeria? Hello? Are you still there, Melanie? Are you still there, Melanie?
Sorry. Yes, sorry, I just dropped out there.
Oh, okay. Did you hear my last question?
No, I didn't, I'm sorry.
So if you have a client who, I guess, comes to you and has really gone to the far end of the spectrum with regards to not eating any fresh foods because they're concerned about listeria poisoning, what advice do you give them?
Well, I guess it depends a bit on the individual, because I always believe that the client is always right, and it's about educating them and working with them and their own individual beliefs and doing things that are right for them. But I think that it's a lot of people just don't know about what they can do to help prevent listeria. So, for example, just by making sure that they are using like that they're washing their fruits and vegetables before eating them, and that they're cutting them on separate cutting boards, and washing their knives in hot soapy water before using a knife on different fruits and vegetables. Maybe taking their own so that they are not reliant on foods that other people have access to. It might be about taking something to work with you. So, for example, you could take a cucumber, and if you're really concerned, maybe taking a grater as well, or a peeler, sorry, and just peeling the skin off the cucumber. Now, that's something that I normally wouldn't worry about for people. It's quite good for you to eat the skin of a cucumber. But if somebody was quite concerned about listeria, then that would be something that you could do just to help reduce the risk of listeria and help them to feel more confident in eating that cucumber.
Okay, so it's really about, so it's really about just having an increased awareness of health and I guess cleanliness.
Yes, that's right, exactly. So yeah, just really helping them to looking at their individual meal plan, their daily routine, and helping them to feel more confident to bring some of those foods back into their diet again, and just showing them what they can do to improve their hygiene without giving up these foods.
That's right, and I think that's important as well, because when people know that you're working with them, they take more ownership and they're more likely to I guess be able to follow the advice that you give, whereas if you completely try to change something that that is someone's routine, it's much more difficult to help them.
Yeah, absolutely. And I think another problem is that now that we've got so much access to nutritional supplements, a lot of people think, oh, well, as long as I'm taking this multivitamin, then I'll be getting all of the nutrition that I need for my pregnancy, when that's actually not true. Again, your supplement requirements will vary both depending upon your diet and your medical issues. And so one supplement isn't actually a one-fit-all for every woman during their pregnancy. And that's where I really recommend that women are getting that individually tailored advice to see, oh, okay, well, how much additional vitamin D do you need, and how much additional folate do you need, and just making sure that it's very individually tailored.
Yep. I've just had another question. Someone wants to know if they wanted to do more research or find out more about listeria, is there any resources that you can recommend?
Yeah, look, I'd probably just go to the government resources. I know that New South Wales Health, I'm a Melbourne girl, but I think it's New South Wales Health have got some great resources on listeria. And the FSAN's website as well, which is the, what do they stand for? Food Standards Australia and New Zealand. They've got some great information about listeria as well.
All right, fantastic, thanks. I've just got one more question. What advice do you give women who are in their first trimester and suffering from morning sickness, as I find most can only stomach carbohydrates and often don't want to eat anything, let alone anything fresh and healthy?
Yeah, look, that's a really good question, and I agree. It's a really big issue because it's often when women gain more weight than they should or than they need to, in that during the first trimester, women actually, so the IOM guidelines, which are the main weight management guidelines for pregnancy, the Institute of Medicine, they actually recommend that women shouldn't gain any more than 2 kilograms during their first trimester unless they're underweight according to a BMI when they conceive. So, and because the growth of your baby during the first trimester is really only a growth of cells. Your baby at the end of the first trimester is so tiny that your baby's certainly not going to be adding any extra body weight, and any of that weight that you gain is really just fluid weight. But a lot of women are gaining sort of 4, 5, 6 kilograms because of the fact that they're eating so many kilojoules, often because they think that they should be gaining a lot of weight during pregnancy and they're not. So how do I get them to eat fresh foods? Well, one thing that I don't often recommend, but I often do for a woman during her first trimester with morning sickness, is juice. So juice is often, it's obviously quite high in kilojoules compared to eating fresh fruit, but but for somebody who's got really severe morning sickness, having some juice can be a good way to get in some fresh fruit and veggies, and can actually be quite a good way to help decrease some of the side effects of morning sickness as well. Also things like the temperature of your food and the smell of your food. So often going through practical things like getting people to eat outside where there's a lot of fresh air, so that's going to diffuse the smell of food, and that really helps to decrease nausea. And choosing foods that are of a room temperature rather than that are cooked and hot that again have a strong smell. Having sort of more room temperature foods or cooler foods can often be easier to handle when you've got a lot of morning sickness. And often, particularly for those women who do actually suffer morning sickness in the morning, having something small to eat before they get out of bed can be a great trick as well. So there's a few little tips like that that can make a bit of a difference.
Fantastic. And I think when you were talking about gaining too much weight, Christine then posted and asked, is it safe to lose weight during pregnancy?
Oh, that's a really good question. Look, there certainly has been research done on it that shows that if you are in a BMI greater than 40 and you are doing it under the guidance of a healthcare professional, then it can be safe. But it's not something that I would go around advertising to people that it's safe to do sort of just generally. You certainly don't want people dieting throughout pregnancy, but if people are doing it under the guidance of a healthcare professional, then yes, I do believe that it can be done. And I certainly have had clients who have lost weight throughout their pregnancy in that, like I said, particularly women who have a BMI of greater than 40, so women who start off maybe at a BMI of a weight of sort of 150 to 200 kilograms, and for the first time they're really motivated to eat a very healthy diet because they're pregnant, and often they will just lose weight without trying purely because of the fact that they're eating so less kilojoules than what they used to. So as long as they're still meeting all their requirements, then that's fine.
Yeah, and I think it's...
and the other thing...
Sorry, you go.
Oh, sorry, I was just going to say the other thing is just to be working in a team with the obstetrician, and obviously they'll be scanning for the baby growth, but that's something just to be very vigilant about if a woman is losing weight. You just need to make sure that the baby is still growing at the correct rate as well.
Yeah, no, I think certainly the best option is always to have someone looking after their weight loss prior to getting pregnant, so they can actually have a healthy pregnancy rather than having to worry about it while they're also worrying about having a healthy baby.
Yeah, absolutely. That would be the ideal situation if possible.
So just another question, I guess, with a few of the people who are listening in today, they do assist with weight loss programs for their clients, but they may not be able to necessarily deal with some of the health issues that occur during a pregnancy. So what advice would you give to other health practitioners with regards to identifying health issues that need to be referred?
Yeah, that's a good question. Yeah, look, I think, so first of all, I guess to say I'm a big believer in weight loss consultants, in that the research shows that one of the biggest things that has an impact on weight loss is accountability. And so if there's consultants out there who are great motivators and great hand holders, then that's a wonderful, wonderful thing for weight loss consultants to be doing. But I also do think that it's really, really important for those consultants to have a relationship with probably a GP and an accredited practicing dietitian, and probably a psychologist and an accredited exercise physiologist as well, so that when things do come up that they need to refer on, that they can do so. And I think that makes a great multidisciplinary team. So the types of things that you want to refer on to for pregnancy, well, I guess I am a big believer that every woman, when they fall pregnant, should have at least one appointment with an accredited practicing dietitian, because your nutrition requirements do change significantly when you fall pregnant. So, yeah, so I would recommend that if one of your clients does fall pregnant, that's just a time where you should refer on that client and sort of say, okay, well, have you had an appointment with a dietitian? And, you know, the chances are that they probably only need one or maybe two consultations, and then they can come back to you. So just to actually put the meal plan together to get their unique nutritional supplements organised, and have a look at their blood tests and make sure that they're meeting everything that they need to meet there. Another time, though, would be if a client was diagnosed with a new medical condition. So if they're diagnosed with something like gestational diabetes, or maybe some, well, I guess anything, hyperemesis, or some hypertension or thyroid problems, or any of those types of issues, they're also good times to be referring back to a dietitian. And then I would say probably the third time when you would consider referring would be if they were not gaining weight fast enough, or if they were gaining weight too fast and you weren't having much success with helping them with, you know, that they still need to meet all of their nutrition requirements. That's probably the third time when you might consider as well. But I think most of the time consultants know when they get a bit stuck.
Yeah, yeah, and you know, and it's, you know, I completely agree with what we were saying earlier as far as you know, having a multidisciplinary team around you with you know, accredited practicing dietitian, exercise physiologist, etc. And that's certainly what we encourage with our students, is to have that team around them and create those networks within their communities, because it is so important, you know, to be able to have the client feel comfortable that they've got you know, the resources they need and the support team that they need around them, you know, at any time during their weight loss program, but certainly if they're continuing to see you throughout their pregnancy as well. So I've got another question up here. Just, you've mentioned gestational diabetes a couple of times. Could you provide some insight into what the sorry, it's just typed a bit funny. I think she just wants to know basically what are the things that we should be aware of, like if the client doesn't know they've got gestational diabetes?
Yeah, sure. Well, first of all, so when a woman is pregnant, it's a standard test for women to be tested for gestational diabetes sort of toward about the end of their second trimester. So, yeah, pretty much every woman is tested for that. Yeah, it'd be pretty rare for somebody to skip that test. And so then they would come back with a diagnosis one way or the other. So gestational diabetes, for those that don't know, is a diabetes that only occurs during pregnancy. So when they didn't have diabetes before, and then they develop diabetes during pregnancy, and then it goes again at the end of their pregnancy. Although saying that once somebody's had gestational diabetes, then their risk of developing type 2 diabetes after pregnancy also increases. But the reason for that is, again, you have so many hormonal changes during pregnancy. And actually, I'm a big believer that most of weight gain is actually hormonally driven. So when we have all these weight changes during our pregnancy, they kind of cascade to go on to have an impact on a type of hormone which is called insulin, and which we talked about a little bit before with insulin resistance, because being overweight is another trigger to impact your insulin levels. And so when women fall pregnant and their hormones fluctuate so much, again, it can impact their insulin levels, and then this can go on to impact the way that a woman is able to digest her carbohydrate. And having gestational diabetes, if it's left untreated, can actually have significant impacts upon both the mother and the baby, because often women who have gestational diabetes, their babies get too much carbohydrate because the insulin isn't keep managing the amount of carbohydrate in the bloodstream. So the babies get too much carbohydrate and the babies grow too big, and then when they go to be delivered, women sometimes have to have a non-elective cesarean because of the fact that their babies are too big, which can often mean that their babies have to be delivered earlier than ideal. Or sometimes if it is a natural birth, sometimes the babies can be so big that their shoulders break, or the mum's pelvic bone can break during delivery as a result of these really large babies. So it's a very important thing for somebody with gestational diabetes to be treated, and usually the range of the blood glucose levels, so the amount of carbohydrate in the mum's bloodstream, needs to be very closely monitored throughout her pregnancy, much more so than for other people who have diabetes, to make sure that their baby isn't getting this too much carbohydrate. And so, yeah, we have to monitor this amount of carbohydrate in their bloodstream very, very closely. If they are getting too much, the first thing would be to make changes to their diet to make sure that they're not getting too much carbohydrate, but that can be a little bit tricky sometimes, if particularly if because a lot of carbohydrate foods are also very nutritious and are foods that provide key nutrients that the mum needs to consume during her pregnancy, and that's often where women need to go on insulin injections throughout their pregnancy. And those insulin injections can often be stopped again at the end of, once the baby has been delivered.
Fantastic. And got another question leading on from that. Can a fit, healthy woman get gestational diabetes, or is it just less than optimal health mothers?
No, absolutely. It often does happen in fit, healthy women, and particularly tends to happen with women from non-Caucasian backgrounds. So particularly women from Asian backgrounds have a very, very high, Asian and probably Indian as well, and African, very high incidences of gestational diabetes. And again, that comes back to genetics. So women from Asian, African and Indian backgrounds tend to have a higher genetic predisposition to developing any type of diabetes, but particularly gestational diabetes. And so that's where it can be really difficult, because sometimes you'll get in these tiny women of, they might be 40 kilograms and sometimes not even gaining enough weight during their pregnancy, yet still develop gestational diabetes. So the answer is that no, it's not always women who are overweight, but when women are overweight, that does increase their risk significantly of gestational diabetes. And the third group of women is the group who were a healthy weight at conception, but those who have gained too much weight during their pregnancy, they also have an increased risk of gestational diabetes as well.
Fantastic. So is there anything that clients can be recommended to do to lessen the risk of developing gestational diabetes?
Yeah, absolutely. There's a few things. First of all, I would recommend exercising throughout pregnancy if possible. So there's a lot of women who I guess think that it's dangerous to exercise throughout pregnancy. The research has shown very, very clearly that unless you have some type of health problem and is specifically advised not to by your doctor, that you actually should be exercising throughout pregnancy. But you do need to do so cautiously, and your exercise during pregnancy does need to be a little bit different than regular exercise. one of the things that I often tell women is that they need to remember that when they give labour, they're essentially going to be going through a 16 or an average of 16-hour marathon. So they actually need to be at their peak exercise fitness come the end of their pregnancy. So when you exercise, that actually helps your body to burn that excess glucose, that excess carbohydrate. So exercising right throughout your pregnancy is a really good idea, and like I said, unless there's a problem with that. I guess secondly, it's also about making sure that you are eating a healthy diet during pregnancy and not gaining weight too quickly. When you're eating foods that are really highly processed, so having soft drinks and lollies and highly processed foods and foods that are high in saturated fats and so forth, they have a higher glycemic index, a higher GI, and they will raise your insulin levels higher as well. So it's a good idea to stay off those foods. And like I was saying before, you really want to pay more attention to your diet during pregnancy than any other time of your life. And then I was also mentioning there about the types of fats, so that can play a role as well, making sure that you don't have too many of those bad saturated fats. So yeah, that'd be sort of three key things that I would advise to help reduce the risk of pregnancy. And the other thing that we mentioned before was making sure that you don't gain too much weight during pregnancy. That probably has a bigger impact than anything.
Fantastic. And I think just moving on from that, maybe a bit more of a general question to finish up on, but what would your top five weight management tips be for clients to help them maintain a healthy weight during their pregnancy?
Okay, top 5 weight tips for during pregnancy. Well, number 1 would be to have at least one appointment with an accredited practicing dietitian so that you actually learn about portion sizes and how many kilojoules you need as an individual and what that actually looks like. So actually get a meal plan designed. Number 2 would be, there's a really interesting study a few years ago that showed that women who knew how much weight they actually had to aim to gain throughout their pregnancy had double the chance of actually achieving that weight gain than women who didn't know how much weight to gain. And so, you know, it seems like a pretty basic thing that most women wouldn't have a clue how much weight to gain during pregnancy. They just kind of eat whatever they want and don't worry about it. So having regular weigh-ins and knowing how much weight I think is really important for all women during pregnancy, even those who were a healthy weight at conception. Number 3 would be to be really vigilant about your intake of those extra processed foods during pregnancy. You might find that you're more hungry and so forth during pregnancy, and that's fine. You do have some additional kilojoule needs, but you know, make sure that you're using those up on really healthy foods. And you know, pregnancy really isn't the time to be having a lot of chips and donuts and hot dogs and fast food and so forth. So be really vigilant during that time. Number 4 would be to actually exercise during pregnancy. Like I was just saying before, a lot of women are quite apprehensive about exercising during pregnancy, but it's a really, really great thing to do for so many different reasons. So I'd highly recommend that. And tip number 5 for maintaining a healthy weight during pregnancy would be probably to I don't know, there's a few things really. I think just being really well educated and planned though. A lot of women surprisingly just kind of wander through their pregnancy without really knowing what to expect. and just listening to word of mouth and dealing with things as they come up. Whereas if you can be educated about the types of things to expect and to know that during your first trimester that you're going to be more tired than usual, so you may need to say no to a few extracurricular activities so that you've got the time and energy to exercise, and then come second trimester that your energy levels will peak and that you'll have, you probably have more energy than you've ever had before come second trimester, and so that's a really good time to get into exercise. Come third trimester, you'll be tired again, and so make sure that during your second trimester that you really, you might be pre-preparing some meals and freezing them, or you might be doing your meal plans and getting everything really well planned during your second trimester rather than leaving everything till the end. So things like that, really planning as much as possible and educating yourself as much as possible, I think is a really great idea, and that can have a big impact on your weight and health as well. So yeah, that'd be my top 5 tips.
Fantastic. I think the second point was really interesting about the percentage of mothers who know what their weight gain should be, that actually then achieve that. And I guess that's both not gaining too much weight but also gaining enough weight.
Yeah, that's right. And it's interesting because the higher your BMI is, the less weight that you actually need to gain throughout pregnancy, because your baby, when you deliver, is usually only about 3.5 kilograms. So if you're putting on 20 kilograms throughout your pregnancy, you're not putting on 20 kilograms of baby weight. So women sort of forget that a lot of the weight that they're putting on, there isn't actually a need to put on that much weight. And so even if, again, you're a healthy BMI, the recommendations are 11.5 to 16 kilograms. Well, there's still only 3.5 kilograms of baby weight. So there's actually around about 3 kilograms of stored body fat during that time, as well as some additional fat in your breast to increase breast size ready for breastfeeding, additional fluid stores, the blood volume, and things like that. So when a woman is in an overweight or even more so in an obese category, they don't need to put on as much extra body fat, and so the amount of weight that they need to gain is actually significantly less. So the more overweight someone is, the less weight that they actually need to gain during their pregnancy.
Well, I guess that also explains how sometimes I've seen on the news on a few occasions now where there has been an overweight woman who suddenly went to the toilet and delivered a baby without knowing she was pregnant.
Yeah, and that can happen occasionally. It doesn't happen all that often, but which is why it makes the news. But yeah, occasionally that does happen.
I've got another question from Daniel. What is your opinion on to-be mothers who still spray tan, colour their hair and get their nails done from a toxicity point of view?
Oh, I'd actually say that's a bit outside my scope of expertise. Yeah, so I can sort of answer pretty much any questions when it comes to food and nutrition, but spray tans are a bit outside my area of expertise. Sorry, Daniel.
Okay, cool. Well, I might get, if anyone else has any questions, if you can just quickly throw them up onto your question screen. And just while you're thinking about some other questions that you might like to ask Melanie in the last 5 minutes that we have, I just wanted to share 2 bits of information with you. Firstly, for anyone who is interested in finding out anything more with regards to weight management, we do also have Professor Abdullah Mammon presenting on a similar topic. Then please visit the website globalweightmanagement.org and check out the speakers program there for more information on that. And Melanie has also got a fantastic offer for everyone who is listening today. If you are interested in finding out more about her book, you can actually get a copy for 50% off. So all you need to do is call her reception on 1300 438 550, or you can email reception@nutritionplus.com.au, and you can organise, as long as it's by the end of the month, a copy of her book for $15 plus postage and handling. Do you just want to perhaps give the listeners a little bit of an overview of what's covered in your book, Melanie?
Yeah, sure. It's actually been designed to use as a really practical research for either clients by themselves or to do it hand in hand with their healthcare practitioner. So there's lots of opportunities for them to answer quizzes and sort of tick the boxes and those types of things to work out what their actual needs are. So it goes through and helps them work out how much weight they should be gaining throughout their pregnancy. And so there's lots of tips and tricks both about weight gain throughout fertility as well as throughout pregnancy. There's also weight management plans or meal plans, 7-day meal plans in the book for fertility, trimester 1, trimester 2, trimester 3, and then whilst breastfeeding. And there's exercise plans in there as well, plus a whole lot of recipes. So it's a really practical resource, and yeah, it's been really popular. I've had really great feedback from it, and yeah, it's just really practical. So it's been good.
Fantastic. Well, just I guess in case anyone's thinking this, I might ask the question: if anyone wants to purchase the book, I guess in a bulk purchase to be able to, I guess, on-sell to their clients, is that something you offer as well?
Yeah, it is actually, and it's often something that we do. So again, if people just speak to my receptionist, and she can go through all the prices and so forth with people to help them do that. But that's actually a really good thing to do, is to buy them in bulk and then work through them with your clients.
Fantastic. That's great. Well, we haven't got any further questions. I think we pretty much answered them as we were going through today's interview. So we might wrap up, and I just really want to thank you for your time today, Melanie. I know you're busy, and you know, just to be able to share your experience and your knowledge with everyone is really greatly appreciated.
Oh, my pleasure. Thank you very much for having me. And if I can just mention, I've also got an e-newsletter and blog on melaniemcgrice.com.au. So if anybody does have any further questions or anything, they're welcome to contact me through that.
Fantastic. Thanks, Melanie. And I'll make sure to put all those details onto the email that I send out tomorrow, so that you do have Melanie's contact details and also the information about the book if you'd like to purchase a copy. So thanks again, Melanie, and enjoy the rest of your day.
Thanks, Anya.
Bye.
Bye.